Hello everyone, welcome to the module on GERD, which is the gastro-esophageal reflux disease. As implicated in the name, it's a condition whereby there's an upwards flow of the gastrix or the stomach's content into the earlier compartment of the esophagus. As we know anatomically, this is most of the time prevented by the closure of the sphincter, which acts like a door in a way, right? So when it's closed, the acidic contents of the stomach would not enter the esophagus to corrode the surface or the epithelial surface of the esophagus. However, due to certain conditions whereby there's an increase in the pressure of the stomach, or there's a loosening of or the relaxation of the sphincter muscles, GERD could happen, right? What are the examples of such conditions? Probably due to the person maybe after a very heavy meal for some people, right? And also in pregnancy, whereby hormonal changes can actually cause relaxation of the sphincter, right? And also the pressure of the baby pressing towards the stomach, it can also cause GERD. However, if it's pregnancy-related GERD, it's normally resolved after the pregnancy. There's also anatomical difference between the esophagus and the stomach, right? Whereby we already know that there's an additional protective mucosal layer which actually prevents the acid in the stomach to corrode the surface, right, of the stomach. However, it's not present in the esophagus. Therefore, the corrosion of the acidity can actually cause symptoms such as heartburn, or burning or acidic feeling at the end of the tongue and so on, right? So in this particular module, we'll mainly focus on the pharmacology, on the treatment of it, some symptoms, causes, and also a little bit of recap on the physiological regulation of the peptic acid secretion. Okay, moving on. So we can see here, so these two diagrams is actually trying to illustrate the same point actually about the regulation. So you can actually choose whichever diagram that you prefer for your revision. So over here, this is the parietal cells. As you can see, the label, it's towards here, but it's actually the same cell type, right? There's this particular proton pump, or you can actually call H plus, K plus ATPase, right? So this is the final exit of the hydrogen ion or the acid molecule in a way into the lumen or into the stomach in a way. So this is the final door, right, or the final pump. So therefore, if there's any drugs that can actually inhibit this particular pump, will be the strongest that can actually inhibit or stop the secretion of H plus into the stomach, right? So there is drugs that actually targets it, such as proton pump inhibitor, which you learn more in the peptic ulcer disease class. The activity of this pump is influenced by multiple modulators. One of it is the histamine. So you can see histamine is actually secreted by the neighboring cell called the ECL cells, but it can actually activate the H2 receptor, which is on the parietal cells, which can then cause an increase in the secretion of the hydrogen ion. So again, if there's drugs that can actually antagonize the receptor, right, you can see that there will be a reduction in the H plus being eventually released into the stomach. However, the effect would not be a complete inhibition like the proton pump inhibitor, because there are other modulators which are still available, which can still stimulate the release of H plus into the lumen, right? So we can see the acetylcholine receptors acting here as well, so which can be activated in the parasympathetic condition, right? So there's also other gastrin molecules and so on. But bear in mind, so acid secretion into the stomach is actually important in maintaining the physiological activity or the optimal activity of the enzymes like pepsin, right? For better digestion of our food or protein, right? So it's not something that we actually want to inhibit it to a very minimal level all the time. We only try to actually reduce the level slightly to allow healing of the corroded stomach epithelial if there is such condition, such as in peptic ulcer disease, right? But under normal circumstances, we actually want the acidity level to be there. So details and explanation on the figures, you can actually read through yourself. So going back to GERD, so the famous symptoms of GERD is heartburn, right, acid regurgitation, dysphagia, meaning difficulty in swallowing, right, and also some inflammation. So there's also some other non-GERD symptoms, so which you might need to pay more attention, which is also known as red flag symptoms, whereby if the customer actually has such symptoms, you actually need to refer it to for further investigation, right? So bear in mind, lifestyle modification is important in reducing the symptoms of GERD. Such as cut down of alcohol or fatty food, cutting down the weight, and also smoking cessation can also help in reducing the symptoms of GERD. So another very what we call physics, yes, condition that a person can implement in a way is to elevate the head of the bed, so that i.e. The person could actually put more pillows, so meaning not just lying flat when they're sleeping, because one of the common time point for example, in pregnancy related GERD or normal GERD for some people, is that when it happens during bedtime, right? So happens, and it's worse in a way around midnight, around 12ish, because it actually correlates with the time point of the increase the physiological circadian rhythm, whereby during midnight-ish time point you actually have a spike in your peptic acid secretion. So together with that and together with the sleeping time, some people can actually feel worsening of the GERD symptoms. So a slight elevation could actually help in reducing the symptoms, but bear in mind it's personally tried before, but it's actually not so easy to fall asleep actually if you're actually sort of lying down at an angle, right? But that's the best one of the person can do if the person want to actually cut down the intake of antacids. So GERD is actually a condition which is most of the time being well managed. So you can actually check the NICE guideline. So as you can see here, the recommendation is actually pretty old, but they do have newer revisions in 2019, but they realized that there's no changes in the recommendation is required. Right, so as you can see here, community pharmacies actually play a very important role in managing GERD, because it's one of the first line whereby people actually come and ask about what can I do about my condition. Right, so as mentioned earlier on, it's very important that for us to recognize the red flag symptoms. For example, if the person actually have it happens very, very frequent, or the person actually tried antacids but it didn't really work, things are getting worse, if there's blood, for example, and difficulty in swallowing, if you don't feel very comfortable with it, just refer the person directly to the GP to get a clearer diagnosis, just in case we miss anything, right? So otherwise, we can also give a simple management like advice like lifestyle changes. There's over-the-counter medications like antacids, right? And also give them other advice as mentioned earlier on. They can give them leaflets, right? So again, it's something that if you can actually tell them to, you can try antacids first. If it doesn't improve within 2-3 days, right, or your frequency of intake is very high, just double check with the doctor, right? So antacids is something that fast in a way. That's why it's good, because it's used just for symptoms treatment, right? So again, it acts in a very chemistry way, in a way, because it's just a simple neutralization reaction that we're actually trying to achieve. So it's something that happens very, very quickly. So the person it's not something that the person has to take very long term, like for example antihypertensive medications and so on, whereby the person just have to take the antacids when the symptoms occur or when it's unexpected to occur. Right, so again, as mentioned, it's a weak base. So basically, it's just to neutralize the acidity in the stomach slightly, right? So because it's follows the stomach emptying time, so again, it just follow the timing of the food. So if it's an empty stomach, it can quickly be cleared out of the stomach within half an hour. If you consume it after food, so again, you can prolong the activity because the whole stomach emptying have to follow the food anyway, right, for the antacids to go down to the next phase. So it's available in different forms. It can be in suspension, it can be in tablets. So if it's in tablets, so make sure you can remind the person to chew the tablet before you swallow it, because chewing the tablet actually break down the tablet obviously into smaller pieces, therefore increasing the surface the surface area, right? Therefore there's greater chances of faster reaction of neutralization that can happen. However, it's also recommended that it should not be given within 2 hours with other drugs, because it tapers or it changes the acidity of the stomach slightly, so therefore it can actually influence the the extent of absorption of other drugs, right? So as if you can remember from the Henderson-Heisenberg equation and things like that that you learned in the year 1. So yes, it influenced the gastric pH, and it's also an ionic in nature for the antacids. So therefore it could form chelator with other drugs, therefore form a huge insoluble complex, therefore you could not absorb the medication. So there are some more important interactions. Please check your BNF. And because due to the ionic nature, so because there's high calcium content, aluminium, magnesium, so there is a maximum dose that the person can consume every day. And especially you have to be take precaution for those with hepatic or renal impairment, because the body system cannot process that high amount of ions in a day. So they could take the antacids but not in large amounts. So there are different types of antacids as mentioned just now. So one of it is calcium carbonate. So it's again very rapidly acting, like all the antacids are, but because of the carbonate nature, it can actually release carbon dioxide. So the person might feel a little bit more belching symptoms and flatulence, right? So it can cause rebound acid secretion as well, like all the other antacids. So there's aluminium hydroxide, which is a little bit slower acting, and it can also slows down the motility of the GI tract, therefore might cause constipation, right? So and there's also magnesium hydroxide. This is rapidly acting, so it may cause a little bit of diarrhea with a little bit of stimulation. So there's other ingredients that can act, like simaticon, which acts like an anti-foaming, right, reagent. So what are the effects when the ingredients are mixed? So for example, if you mix aluminium hydroxide and magnesium hydroxide, you can actually balance out the effect of constipation and diarrhea. So basically there's not much side effects in a way, right? So again, you can have a better profile in the effect as well by combining the slow and rapid acting, right? So let's move on. So these are the different types of antacids which are available in the pharmacy, right? So I just want to show you a very short video clip here. So using Gaviscon as an example, right? So you can see that, yes, excess acid can move backwards. As you can see here for Gaviscon, there's two modes of action. So it actually makes a protection layer, so to prevent the reflux. Okay, so normally, I think that's it about the video. So normally we'll actually ask you all to actually visit your nearby local pharmacy to actually look at the different brands and different preparations available. But obviously now we are stuck at home all because of COVID. So I'm just using one of the example here to illustrate. So a lot of it remains the same pattern. So one of the preparation is actually Malox and Malox Plus. As you can see, most of the companies that actually have two different variants of the Antacids. One is the normal variant in a way. One is the stronger variant, so they put a plus there. So you can see if you compare the ingredients, it's actually at a higher dose with the same amount if you consume. So again, it can be available in suspension or in tablet form. So again, there's a maximum dose that you can take. And again, there's an even lower or under supervision for those especially with chronic kidney disease. So you can actually take it after meals or at bedtime or as requested, right? So there's other brands available like Actal and Actal Plus, Gaviscon Double Action and Gaviscon. And bear in mind, Gaviscon also has a Gaviscon Baby, right? For infants, because some kids, like mine, when they're younger, they actually experience quite a bit of GERD, so they don't really know that, i.e. there's like their sphincter, it doesn't function very well. They don't really feel full when they are actually full, so i.e. like their sensor is not focusing very well, so they actually have a lot of vomiting symptoms of milk, right? So there's actually Gaviscon Baby available, but just to remind you, I've checked the ingredients, it's actually a different content compared to the adult Gaviscon, so it's not just a simple dilution to provide it to the babies, just to bear in mind, right? There's also other local brands like Elucid, right? Other manufacturer like Hurix has its own antacid, and this HCl as well. So getting some information from the textbooks, so you can see that there's again, if you compare, like for example, Gelusil and a double strength, so you can see if the concentration is double, right? So the acid neutralizing capacity is also double, right? So again, from a textbook-based answer, but it's also quite relevant, which is quite similar to what we practice. So which medication to use, as you can see here, you can actually give H2 antagonist and or proton pump inhibitor as well. So it depends on the severity of the GERD. So the severity again depends on the amount of attacks, the number of symptoms experienced per week, right? So if it's quite bad, so that then the person most likely will need to do endoscope as well to check if there's any other underlying PUD, or i.e. peptic ulcer disease and so on, right? So the details information of the H2 antagonist and PPI will actually continue in the peptic ulcer disease class. So here just to remind things. So there's a different names of proton pump inhibitor, just to show there's some off-label use for GORD or GERD. So it depends on the US or UK name of it, right? So you can see they can be started on the lower dose, on demand on the lower dose for those with GERD as well. Okay, so that's it for this particular class. Thank you. See you next round.